If you're over 60, this is something you should pay attention to. There's a process happening inside the body that most people don't notice at all, until it becomes serious. Heart disease usually doesn't begin with a sudden heart attack. It starts much earlier and much more quietly. Inside the arteries, there is a gradual buildup. Cholesterol starts sticking to the walls. Inflammation increases, and over time the blood flow becomes restricted. This happens slowly, which is why many people feel completely normal. In fact, one cardiovascular analysis of over 3,400 adults above 60 found that nearly 72% had some level of hidden arterial blockage without knowing it. That's the concern. People feel fine on the outside while the problem is developing internally, but the positive side is this. Daily food choices can influence this process more than most people realize. There are certain foods that can help slow it down, support the arteries, and improve heart health over time. I'm Dr. Michael Anderson, and I've been working with patients dealing with heart disease, high blood pressure, and cholesterol issues for over 18 years.
Yes, it looks good.
In my observation, when people consistently adjust their diet in the right way, the results can be significant. Many of my patients have seen clear improvements in their heart health markers within a few months. Some were even able to reduce their dependence on medication, of course, under proper supervision. This isn't about quick fixes. It's about using nutrition in a consistent and practical way. As we get older, a few important changes happen inside the body. The arteries become less flexible. Inflammation tends to increase gradually, and LDL cholesterol, the type that contributes to blockage, starts sticking more easily to blood vessels. Over time, this leads to plaque buildup, which reduces the flow of oxygen-rich blood to the heart. That's when symptoms may begin to appear. Things like mild chest discomfort, feeling tired during simple activities, higher blood pressure, or shortness of breath. These are often ignored at first, but they are early signals. The important thing to understand is this: food plays a major role here. It can either speed up the damage or help slow it down. Let's first look at what tends to make things worse. One common issue is processed breakfast foods. Many people assume cereals or packaged bread are light and healthy options, but in reality, these foods can quickly raise blood sugar and increase inflammation. Some studies have shown that people who regularly consume processed breakfast foods have significantly higher levels of arterial inflammation. I've seen this in patients as well. For example, one of my patients, Robert, was following what he thought was a healthy routine. But over time, his blood pressure started increasing, and we had to make changes to his diet. Another factor is deep-fried foods. When oils are heated repeatedly at high temperatures, they form harmful compounds. These can damage the inner lining of blood vessels and contribute to plaque buildup. Regular consumption of fried food has been linked to a higher risk of heart disease. One patient, Linda, came in with constant fatigue. After evaluation, we found early signs of artery narrowing, and her diet included frequent fried foods. The third issue is high-sodium packaged food. Too much salt causes the body to retain water, which increases blood pressure. Over time, this puts extra strain on the heart and blood vessels. In many cases, simply reducing sodium intake can lead to noticeable improvements. I've seen patients bring their blood pressure under better control within weeks, just by making this one change. Now let's focus on what actually helps. There are certain foods that support heart health and can make a real difference when included regularly. Avocados are one of them. They contain healthy fats that help reduce LDL cholesterol. Lower LDL means less buildup inside the arteries. Adding even a small portion daily at like half an avocado can support better cholesterol balance over time. Fatty fish like salmon or sardines are also important. They provide omega-3 fatty acids which reduce inflammation and help keep arteries flexible. Including fish in your diet a few times a week can lower the overall risk of heart-related issues. Leafy greens such as spinach and kale are another key part. They contain compounds that improve blood flow and help manage blood pressure. A simple addition of 1 cup daily can support better circulation. Nuts like almonds and walnuts are also beneficial. They provide healthy fats and nutrients that help control inflammation and support cholesterol levels. A small handful each day is enough to get the benefit. And finally, berries. Blueberries and strawberries are rich in antioxidants, which help protect blood vessels from damage. They support overall heart function and are easy to include in daily meals. If you're finding this useful, consider subscribing to the channel. The goal here is to share simple, practical information that can actually help improve health over time. You can also comment "heart health" if you'd like to see more videos like this. To summarize, heart disease develops gradually through cholesterol buildup, inflammation, and reduced blood flow. Certain foods can make it worse, especially processed, fried, and high-sodium items. But at the same time, simple changes, like adding avocados, fish, greens, nuts, and berries, can support the heart in a meaningful way. This is not about perfection, it's about consistency. Small daily choices can lead to long-term improvements, and over time those changes can make a real difference. If you want to keep learning more about simple ways to support your health, stay connected. I'll see you in the next video.